check the MAR to see what my patient polydipsia has for lunchtime meds. So it looks like 12:30. Polly is due for her aspart insulin. Just checking the MAR, we've got no allergies, so that's good. Regular lunchtime dose is 2 units of aspart, but I did just take her blood glucose and it's sitting at 9.1, so that's using the ISF correction factor. We're going to have to add a unit, so she's going to get 3 units of aspart. So again, her blood glucose that I just took was 9.1. I took that at noon. And like I said, we're going to do 2 + 1. So we're going to be giving 3 units of the aspart. This aspart is a fast-acting or rapid-acting insulin indicated for diabetes. It is a high-alert med. We're rapid onset, so we're talking probably like 15 minutes onset. Duration or peak, sorry, is about 1 hour, 1 to 2 hours. The main adverse effect that we need to be concerned with here is the hypoglycemia, which would be indicated by jitters, sweating, general unwell feeling. And one of the main nursing considerations that we need to take into consideration is just the making sure that she is taking it with food. And I will teach the patient about the importance of that when I administer it. So, moving over to the Omnicell now, I am going to take my MAR over there. I'm going to go in my Omnicell. I'm going to do my 5 right. So I've got the right patient. I've got polydipsia. We've got the right drug, aspart, at 100 units per mil. The right route is sub-Q. The right dose, we've already calculated the dose at 3 units. And we will, the right time, 12:30. Okay, so I'll take that from the Omnicell. I'll go back over to the MAR here. Keep that out, I guess. So I'm going to just check my 5 things again in front of the MAR. I've got right patient, poly. I've got the right drug, aspart at 100 units per mil. The right route, sub-Q, the right time, 12:30. Okay, and my double checks. So I'm happy with that. I'm going to dot the MAR. And at this point, I would get an independent double check because it is a high alert med. So I'd get another nurse to come. I would present her with this information, the records, the blood glucose records, what the blood glucose is. And then I would let her just verify that the dose is correct. So at this point, we're going to prep pen. Okay, before we do that, let's get organized. Do some hand hygiene. So, alcohol swab this really well. Let that air dry for about 30 seconds. Garbage. We are going to, I'm going to prime this little guy. Prime it with 2. Great, that's good. I'm gonna set the dose for 3 units. I'm gonna have my RN give that another independent double check there to make sure she's happy with that. And again, that's documented there for the independent double check. Okay, we'll recap that. We're gonna head into our patient's room. Hello, good morning.
Hi.
Hi, my name is Susie. I'm a second-year nursing student at UBC Okanagan, and I'm just here with your afternoon lunchtime dose of the Aspart insulin.
Okay.
Good. Can you tell me your full name and date of birth, please?
Polydipsia, February 2, 1984.
Great. And do you have any allergies that I need to be aware of? Okay. So at the bedside, I would perform my third check. So I know that I've got the right patient. I've got Polly. We know that we are doing the right drug. We've got the Aspart, 100 units per mil. We are doing the right dose. We know that we've got 3 loaded. That's being checked. The right time and the right route. So we are set to go. Okay. Do you have an injection site that you prefer? Another on there? Okay. And do you have any questions about this drug? You've taken it a little bit before.
No.
No? Okay. One of the main things that we need to really be concerned with is just that you're eating right away after we give it, because it's a fast-acting insulin, so it will drop your blood sugar quickly if we don't have some food at the same time, okay? So right after we give it, you can enjoy your lunch there, and then I'll be back in 20 minutes or so to check on you and make sure that you're not having any difficulties. Are you familiar with the signs of hypoglycemia that you should look for?
No.
So the main things that we would worry about would just be a general feeling of unwell, agitation, just feeling jittery, that sort of thing, okay? And then you can always give us a buzz on the call bell if you're not feeling well. But other than that, are you able to hold that there? I'll be in to check on you again. Let's do a little swab here. So just moving in a circular direction. Take a little squeeze there. You can take a big deep breath. Just holding for a count of 10. Take out. And then I would just assess the site to make sure that we don't have any leakage or anything, no bleeding, that kind of thing. Okay, and if there was any bleeding, we could just put a little tab on there. Okay, do you have any questions before I leave?
No.
Are you comfortable? Do you want your bed lowered or raised?
I'm okay.
Okay, great. Well, you can enjoy your lunch there, and then just give me a shout or ring the call bell if you need anything.
Okay, thank
Otherwise,
you.
I'll circle back and check on you in a few minutes, okay?
Yeah, thank you.
Yeah, you're welcome. Okay, so I'm gonna take my gloves off. Hand hygiene. Leave the room. Probably do some more hand hygiene when I left the room. So then we will just come back to the MAR and document this. Okay, so that was the 12:30 dose. Like I said, that's already been checked off independently. I will check this off here that I gave 3 units of Aspart. And then after that was given, my independent double check would sign off on it as well.